to the full meeting, so that will give Mr. Todd and Mr. Earl a chance to join us. So I'm calling the meeting to order. And with regard to our traditional land acknowledgement statement, I make the following statement. Leeds, Grenville, and Lanark are located on the traditional territory of Indigenous peoples dating back countless generations. We would like to show our respect for their contributions and recognize the role of treaty making in what is now Ontario. Hundreds of years after the first treaties were signed, they're still relevant today. So with that, our next item is 3, which is approval of the agenda. I have designated, and please object if you're uncomfortable with that. Mover is Cheryl Smith, second by Doug Struthers. The motion reads the agenda of the January 21st, 2021 regular meeting be approved as circulated. I'll ask if anybody has any additions or comments with regard to agenda. And I'm going to operate in the past practice of simply asking if anybody object to my declaring this motion carried. Hearing none, the motion's carried. That moves us to 4, which is conflict of interest declaration. Having approved the agenda, does anybody have a declaration to make? And could you give us the nature thereof? I'm seeing none, and I see that Jeff Earl has joined us. Welcome, Jeff. We then move to 4.1, which is conflict of interest form. This is a form that has to be signed annually. And I'm going to have to refer to Heather because Heather, quite frankly, I forgot. Is it in their package, or you're going? I believe you said you're going to be sending them out for people to fill in and return back to you. Am I correct on that?
That's right. I will. Yes. So
just a reminder for everybody to ensure that once you get those forms, that they're returned promptly back to Heather. We're moving then on to the consent agenda, which is item 5. I have down the mover as Ann Warrens and seconder as Peter McKenna. Has Peter joined us yet? Then I'll substitute Jeff Earl. Jeff, if you're okay with that. I'll read the motion that the following items on the consent agenda be approved as circulated. 5.1 is minutes from the Board of Health regular meeting held on November 18th, 2021. 5.2, minutes from the Board of Health special meeting held on November 26th, 2021. 5.3, minutes from the Board of Health special meeting held on December 14th, 2021. 5.4, general correspondence. 5.5, MOH/CEO duty of care report. 5.6 is the Governance and Quality Assurance Committee duty of care report. And 5.7 being the terms of reference, being the Governance and Quality Assurance Committee. Does anybody wish any of those items to be separated out from these as a separate motion? Okay, I'm seeing none. Does anybody have any comments or questions with regard to the items before I call a question? Go ahead, Bill.
Yeah, thanks, Mr. Chair. Just a quick question. I was thinking about this earlier today that when we approve minutes from past meetings, like it's one thing to approve it, but I noticed that we never ask, and maybe we don't need to, but certainly in our council meetings we always do, and that is that we always ask, is there any business arising from those minutes? Because what we're doing now is we're approving the minutes, but we never ask, and I don't have anything to bring up specifically right now about business arising from any of those minutes, but sometimes maybe some people do. So I just wondered, like, do we ever have a chance to put that into the agenda or not, or what? Just a general question.
Thank you, Bill, for the question. I'll let Heather jump in if there's other things to say. I noticed that as part of the package, there is 5.4, which is general correspondence. And these often are motions that are being passed in other health units. And they are things, subjects that anybody reading this part of the package may well feel that we should be supporting those motions by making our own. And so you're absolutely correct in my view that it should not only be, is there any comments or questions, but I guess not any questions, rather, it should also be comments. Heather, is there anything more to add in terms of our process for responding to consent?
Usually when we craft the agenda, we do a section with new business and business arising. So if there are issues that are to come forward, they usually are added to the agenda.
Okay, so that is a little bit of reflex of what we do in our municipality, and that is that our deputy clerk sends out copies of correspondence, and it's thought or expected of council members upon getting these before the agenda of a council meeting is finalized to identify if they would like staff to prepare a report on any one of them, i.e., for example, putting a motion that would be similar to one that has interest for us. So
Yeah.
that what's the follow-up? Bill, go ahead.
Yeah, and just I'm not just thinking of correspondence, but I'm more thinking about the minutes when we approve minutes, because when we're approving the minutes, we just want to make sure the minutes are correct and everything.
Yes.
But and sometimes somebody might want to ask a question. Well, what happened with this, or did we do that, or whatever? That I'm thinking more of the minutes rather than correspondence. But anyways, it's fine. It's not a big
Dr.
deal.
Stewart and then Tony, I see both wanting to respond.
Yeah, I'll let Tony go first.
Sorry, I know I have asked questions about items that were in the consent agenda before without the formality of business arising, and we discussed it then.
Yeah. So, and Doug, I would say that Heather looks through the minutes, and if there's something specific that needs to come back, then she puts it under business arising, just like the Board of Health COVID-19 vaccine policy. And then so often, a lot of them are like, so that's a very specific example that if something needs to come back here, that's how it would come back.
Chair,
Go ahead, Nan.
it's Anne. I'm just going to say that the purpose of having a consent agenda, many years ago we didn't have the consent agenda, but it's so that we can move through the agenda a little bit more quickly, because we do have a lot to accomplish. But if any member does have a question about anything that's on the consent agenda, they simply have to say that they want to save and accept whatever it is. Let's say it was 5.3, the approval of the minutes held on December the 14th. They could just simply say they want to save and accept that, and then we would discuss that particular item.
Thank you, Anne. And yes, with the different opinions here, it's kind of reminding me of the practice that I've observed, well, my time on the board, and I certainly agree that that's the way it typically has gone. I don't see a problem, though, for the chair just reminding anybody that if there's any business arising or comment that they can raise it. But I do believe Anne's view of trying to get things quickly, there is kind of an expectation that it will be raised early. Or as Dr. Stewart is saying, that we rely on Heather for bringing things up that that appear or obvious as being business arising. So I always take it that I'm learning as I go, and I think that's a philosophy that most people take. So your comments are taken with great respect and in the spirit of improving communications here. So I'll keep them in mind, Bill. Thank you.
Thanks a lot, everybody.
Okay, great. Is there any other comment or question before I call the question? All right, does anybody object to my declaring that motion as carried? So that motion is carried. Thank you. That moves us then to the annual meeting requirements, and up early is the chair's report. I will deliver that now. I remember being a student of Toastmasters Club when I was trying to get some skills of giving public talks. They said, never apologize for your talk before you start. You'll already lower expectations. That said, I think I have to mention that I have not had this vetted through Dr. Stewart or Heather in terms of making certain that I got dates or times correct. nor an editorial. And so you'll please forgive that. Once I forward it to Heather, I will ask her to do that. At any rate, this is my report. In typical times, it said that the chair's annual report is useful for taking a look back at the challenges that the health unit and the board faced during the past year and to highlight the successes achieved. I must confess, however, that when I sat down on this year's activities and successes, it all came to me as a blur of activities relative to the roles related to COVID and later the Omicron variant. I thought of the activities related to testing and contact tracing, to getting public health vaccinated as vaccines became available, to delivering the health unit's regular responsibilities under the Health Protection Act, and to responding to overdoses and deaths that were occurring, likely exacerbated by COVID-19. And each of these had a myriad of challenges of their own, which had to be overcome. These included staff resources stretched beyond human limit, shortages of testing facilities and vaccines, the necessity of operating on a needed it yesterday basis, and the need to coordinate efforts with the province or other health agencies, and the necessity to supply and update continual communications to the public and to elected officials. When I think back at the pall of those challenges that the health unit and staff had to face in staring down COVID-19, I was relieved and encouraged at, and I'll say the approximate October 2021 Board of Health meeting when Dr. Stewart and senior staff provided us with a comprehensive status of the health unit's activities. I recall vividly Dr. Stewart telling the board at the end of the presentation, we seem to have hit our stride and we're prepared more than ever to meet any new challenges that come along. And in my estimation, her assessment was correct. In terms of important achievements, though, I would say philosophically that they're almost too numerous to mention as they occurred almost daily. Perhaps, though, I should mention the ability of the health unit and staff to push themselves beyond the limits of human ability almost on a daily basis, the success of our health unit in being recognized as a leader in vaccination rates in the province, and the United Way of Eastern Ontario Community Builder of the Year award given to Leeds and Grenville and Lanark District Health Unit's Medical Health Officer, Dr. Stewart. And I noticed, Dr. Stewart, that you were quick to honor the entire health unit for their efforts during the pandemic, and I thank you and share that view with you. While not comparable, the board faced its own unique challenges related to getting provincial appointees reappointed to the board. While we have managed to keep provincial appointees Tony Serco and Cheryl Smith with us so far, the board continues with an ongoing challenge in this regard. This uncertainty, however, did lead the board to approve the chair's proposal to add a second vice chair to the board. This is provided for increased support to the board chair and improved representation of the northern part of our jurisdiction. Given the valuable contributions of both first and second vice chair, I recommend that both positions become a permanent part of the Board of Health structure. I wish also to express my great appreciation and thanks to Anne Warren for her role as first chair and Peter McKenna as second vice chair. I want to assure you that your assistance to the chair and to the board has been essential and critical to any successes. Over the past year, the ongoing work from both the Governance and Quality Assurance Committee and the Finance, Audit, Property and Risk Management Committee during 2021 ensured that the board fulfilled its fiduciary and governance role. I wish to thank committee chairs and members for their tremendous work. In terms of health unit staff, I continue to hold that we have one of the most skilled, knowledgeable, experienced, and dedicated staff. As I'm sure you know and appreciate, the health unit staff has risen to meet the changing challenges posed by COVID, and all the while have had to attend to the normal health and well-being responsibilities. Their hard work and dedication and skills have exceeded what is often referred to as beyond the call of duty, and on the scale reserved for heroic. I want also to recognize and thank senior managers for their work and ask that they convey the board's pride and gratitude to their staff. Finally, I wish to express my pride in, awe of, and gratitude towards our MOH, Dr. Stewart. While staff pushes himself to near exhaustion, I see evidence of the same thing with Dr. Stewart. I wish also to thank you on behalf of the board and the public for your efforts in keeping me, board executive, and board members informed. Thank you for your tireless work that you do in communicating with elected officials and the public. I wish to thank you for your devotion and efforts towards keeping us all safe. Finally, to board members, thank you for your work. Your wisdom, collegiality, comments, and discussions have been key to good decision-making during 2021 and have provided me with valuable assistance and direction over the past year. I have no hesitation in confirming for the public that they have been well served by this board. And so I thank you all. So those are my report. And we move to 6.2, election of officers. And I believe, and correct me if I'm wrong, Cheryl, this is where you take over for this portion.
That is correct, Doug. Thank you very much. And I really appreciated your report. It was very, very well expressed. I'm going to present the nominations report from the Governance Committee for the election of officers for 2022. We have a slate of nominees for the position of chair, first vice chair, and second vice chair. And they are as follows: Chair Doug Malanka, first vice chair Peter McKenna, and second vice chair Ann Warren. As required by our bylaws, I do have to ask if there are any nominations from the floor for the position of board chair. Are there any nominations from the floor for the position of board chair? And third, are there any nominations from the floor for the position of board chair?
If you need a motion to close nominations, I will make that motion.
Thank you very much, Doug. The nominations are therefore closed, and Doug Malanka is proclaimed chair of the Board of Directors for 2022. Congratulations.
Thank you.
If you needed a seconder for that motion, I will second it.
Do we need a seconder?
Should, and all in favor.
Okay, and all in favor. All right, seconder for the motion.
I believe it was Bill Dobson said he would.
Okay, yes, Bill Dobson.
Thanks.
All in favor? Hands?
Yep.
All right, that is then, that nomination is acclaimed or proclaimed. All right, I'll do better the second time around. I didn't have this script again. So now we are opening the floor to the first vice chair. The slate is Peter McKenna, but I will ask once, is there any nominations from the floor for the position of first vice chair? Asking second, is there any nomination from the floor for the position of first vice chair? And third, are there any nominations from the floor for the position of first vice chair?
I'll move nominations be closed.
And seconder for that?
I'll second it, but I have one quick question. Is Peter with us? I don't see him on my screen.
I don't believe he is.
So I would think then that maybe this has already been done, but we would want to make sure that these nominees who are being acclaimed are saying yes.
Thank you, Bill. I had a conversation with Peter a short while ago, and he indicated that he would accept the nomination.
Thanks.
All right, then. So we have a mover and a seconder, and we can acclaim or proclaim that Peter McKenna is elected as the first vice chair of the board for 2022.
Madam Chair, just to cross the T and dot the I, I think I heard you ask if anybody was opposed to the motion to close the nominations. I think I heard you say that.
You did, I said it. You're gonna do it, you're doing this next year. Okay, now on to the position of second vice chair. And Warren has indicated her interest in sitting in this position. I have to ask for three times for the motion from the floor. Are there any motions from the floor for the position of second vice chair? Any motion from the floor for the position of second vice chair? And third, ask, are there any nominations from the floor for the position of second vice chair? If
Again,
those-
I'll make a motion to close the nominations.
I will like a motion to close the nominations.
So moved.
All right, and a seconder? Tony Circo. Nominations are closed. Are all in favor? All in favor? Congratulations for the three positions for the executive for 2022. We have elected, and this ends the election of officers.
All right, then, thank you so much, Cheryl, and for myself, thank you all for the confidence, and I'll certainly try to even get better. And to that extent, if any of you have any suggestions, observations over the past year of things that I might do as chair to improve the effectiveness of the chair, I'm more than happy to receive those either during the meeting or personally. So thank you all. Anne, did you wish to say anything?
No, I just wish to thank everybody then. I'm pleased to be back on the executive again, and I'm pleased that Peter will take over as the first vice chair. I think he will do a very good job, as will you, Doug. You've done a wonderful job over the last few years.
Well, thank you, Anne. And I remember Cheryl at one of the meetings in terms of her hopes for the nominations that would come forth is the value of stability and maintaining the pattern that we have. And I want to appreciate so much, or express my appreciation to you and Peter for agreeing to come on as chair and as first chair and second. I won't say that it was a condition of my putting my nomination in, but it had a great weight to it. So thank you very much. So with that, I'm going to take us then to, we move directly to item 6.3. And this deals with the a motion for the borrowing limit. I have a motion for that. It is moved by Bill Dobson, seconded by Tony Circo. The motion reads, the signing officers for the Corporation of Leeds and Grenville and Lanark District Health for the year 2022 are as follows. Medical Officer of Health, Dr. Paula Stewart, Finance and Property Manager, Sophia Wang, Chair, Doug Malenka, and Director, Shani Gates. Is there anybody that wishes to have comment or discussion of this motion before I call a question? Okay, I'm seeing none. I'm going to call the question. Does anybody object to my declaring this motion carried? Then it is carried, and I'm just quickly reading the motion, and there's a part that I haven't read, and perhaps I should in case it needs to be. The motion also contains a statement says, I certify this to be true copy of the resolution passed by the Board of Health of Leeds and Grenville Lanark District Health Unit at the meeting duly called and regularly held on the 27th day of this January 2022. So that will be a signature by Heather. Sorry, Heather, I just had forgot to read that part. So the motion is carried, and we'll move then to 6.4, which is a motion dealing with a borrowing limit. The motion I'm going to suggest is moved by Doug Struthers, seconded by Jeff Earl. It reads that the medical officer, health or finance property manager, together with the chair, are hereby authorized and empowered to borrow from RBC Royal Bank on behalf of the Corporation of Leeds, Grenville, and Lanark District Health Unit from time to time as may be required by way of overdraft not exceeding in all at any one time the sum of $350,000. Again, I'll ask if there's any comments or discussion with regard to this motion. I'm seeing none, so I'll ask if there's any objections to my declaring this motion as carried. Seeing none, this motion is carried. Thank you all. We move to the next motion, which deals with the appointment of an auditor. And in this case, it is moved by Cheryl Smith and Bill Dobson. The motion reads, it is seconded, that KPMG be appointed auditor for the corporation of the Grenville and Lanark District Health Unit for the year 2022. Rather simple, but difficult to read for some reason. Is there any comments or questions with regard to this motion? Seeing none, does anyone object to my declaring it carried? Then that motion is carried. Thank you all. So we have 6.6 now, which is 2021 annual report presentations. And we have, it appears to be 6 presenters. So I'll turn it over to you, Paula, and perhaps you can let me know when we're moving to the next person. Thank you.
Okay, that's good. So first, Doug, thank you for your kind words. I have to say thank you to every single face that I see and names that I see where I don't see a face. You have given me incredible support this year. And our calls at 11:45 on Fridays and meetings with the Governance and Finance Committee, those are so important to me, and I can't thank you enough. And I'm really pleased that Doug and Ann and Peter will continue, because we have a good relationship, really good working relationship, and I think it will stand us in really good stead this year, just like last year. So thank you. So Paul, if you could pull up the slide. So all of the directors are going to be reporting on their area. This is a chance for you to really have a peek into our lives for the last 12 months. And so you'll see all of our names, and we will go in sequence, Doug. So I think it'll sort of take care of itself.
Great.
So could I have the first one, please? The next one. So, I was thinking about this presentation, and I thought, wow, like we have held true to our strategic plan. So COVID was a huge event in our lives, and we have stayed true to the things, to our role and what is important to us as a health unit. And never more than COVID could we say that our health is influenced by what we do as individuals, the interpersonal relationships, the organizations that we're part of and who guide our work, our community, the neighborhoods. Like Cheryl, you've done so much with your neighborhood. Like this just describes our experience with COVID in Lanark, Leeds, and Grenville, and what a wonderful response we have had by every single part of that community. And I think that we are honored as a health unit to describe to you today what are the things we have done to assess the health of the population, its assets and needs, to prevent health problems, disease, and injury, to promote health in healthy communities, and protect the community from infectious disease and environmental hazards. Try the next one. And then, we held to our mission to work with our communities. So important. All of you who are involved in the developing the strategic plan might have seen that COVID would come along, because it's working with our communities to protect and promote the health of the people and the environment through public health leadership and partnership. And the vision, and then our values of integrity, optimism, which Doug, as you said, is so important through this, connectedness really has made the difference for everyone, I think, and compassion. So what we're going to present to you is nested within the strategic plan that we developed, and the board was so involved in that, and it has guided the work that we've done. So next one, please, and I'm going to turn it over to Becky. Becky Kavanaugh is the acting director for the Healthy Growth and Development Department.
Hi everyone. Hopefully you can hear me. I think I've met most of you before, but thank you for allowing a little bit of time on your agenda to talk about some of the great COVID work, as well as our non-COVID work that we've been doing for the last year. The first goal in the strategic plan is that of health equity. And, you know, our goal in our activities in this area is really just to try to meet our community members and our clients where they are, trying to help them realize their own potential and address some of those things that actually make it more challenging for them to meet some of their health goals. So we realized that a lot of the work that we do had to continue in this area. We know that COVID unveiled a lot of health equity issues, brought them to light, which is a good thing. So, you know, it helped us kind of figure out where we needed to draw attention. So we really worked with our community coalitions. They stayed active. Our health equity coordinator did 2 presentations to groups to highlight the principles in health equity and how important it is. We did some advocacy around the living wage for Leeds, Grenville, and Lanark. And then we really spent a lot of time on food security issues, having people get access to good, healthy, safe food. Next slide. One area that's a little bit dear to my heart is dental health or oral health. That was one of my portfolios before COVID. And I'll speak about dental and oral health for children in a little bit, but one area that isn't necessarily covered as well is adults and seniors. So in 2021, we received a $15,000 United Way grant. We've been very successful in getting a grant for the last few years. And this program, our Emergency Adult Dental Treatment Fund, provides up to $300 for those that are 19 up to essentially 64, because then they can go into the Ontario Senior Dental Plan. So last year alone, we were able to help 67 individuals. And now these are individuals that have a financial hardship, but that are in pain or have an infection. So they're triaged by our dental team, and then we work with community dentists to provide them the care they need. And thank you, Mr. Chair, for signing our most recent application. It was actually submitted today. So hopefully we will be a recipient in 2022 and we can continue that program. Our Ontario Senior Dental Care Program is one that we do in partnership with Rideau Community Health Services. They actually operate it for us on our behalf. With the closure of dental practices in COVID, we saw less people than we wanted to. And we also, when they did get back up and going, there were new IPAC guidelines that dental practices had to follow. And the one that kind of impacted us was the airflow. So based on, because they do aerosolizing generating procedures, there was a lot of fallow time in between patients. So we went from being able to see maybe 7 to 9 patients a day to seeing 3 to 4, because we needed to let the operatory sit for an hour and a half in between patients so that the air could circulate. Towards the end of 2021, we actually got a notification from the ministry that they are going to give us some capital dollars to be able to work on the HVAC systems in our operatories to hopefully shorten that fallow time. So we did submit a proposal to them on how that would be spent, and hopefully we'll find out in the next few weeks and we'll get that going. So hopefully our numbers will be a little bit better in 2022, but we still were able to help support 319 clients. They saw a dentist, 246 saw a hygienist. And I did look at our dentures, because dentures are a part of this, and we actually were able to get 22 people outfitted with new sets of dentures last year. So health equity in COVID times. So we definitely changed directions a little bit and put some activities and initiatives in place to help people that are directly impacted by COVID. We we embedded lots of determinants of health aspects into our COVID response, whether it was case and contact management, whether it was testing, vaccinations. For those that had transportation issues, and there was just no way around it. Not only did we promote the transportation programs offered in the community, but we also have a really good partnership with our EMS, and they were able to do in-home testing, in-home vaccinations. And we were able to work with other partners to do wellness checks on people. So when we did case and contact, we talked about food access. We talked about supports from family members. So we definitely made a concerted effort to embed those aspects in all of our COVID response. We helped our partners with their policies and procedures and information that they share with their partners with, again, that COVID lens. We participated in the isolation and centers and the social distancing center in Leeds and Grenville and in Lanark. We helped with staff and some of our harm reduction services. And we also reached out to our local Indigenous community to promote COVID vaccines. You may have remembered or not, but they sometimes had different eligibility criteria than other groups. So we really wanted to make sure that that population was well aware of what they were eligible for. So we did have lots of communication with them, which is something that's kind of relatively new, and hopefully those relationships will foster post-COVID. And again, just about food access, we are very fortunate to have partnerships with the Brockville Area Community Foundation and the Table. They offered us gift cards to give to those in need. And an example of this is early in the pandemic, early last spring, there was a single dad in Smith Falls, 2 young children. One of his child had COVID, so they all had to isolate. When a family home visitor did a wellness check, like they checked them every day, called to see how the little one was doing. Dad was very frantic because he had no food in the fridge. He couldn't leave the children. They were isolating. She actually took one of the grocery cards, ran to the grocery store, got him about $50 worth of groceries to get him through the next few days. And so, that's just one example of how this program has really, really helped those in the community. And the next goal that we focused on is our healthy infants and children. And we know that despite COVID, we still need a lot of work to be able to help support new moms and children as they, especially in those early years. So next slide. We, even within all of our COVID work, we were still able to support 217 families with online prenatal courses. We continued with our Healthy Babies and Healthy Children's program throughout, maintaining 48-hour phone calls, maintaining visits for those that are at highest risk, whether it was virtual and sometimes in person. We continue to support the Good Food for Healthy Babies programs, and we kept our Healthy Smiles Ontario program going for urgent care needs to get children either on the program that desperately needed it, or those that were actually in pain or had infection that they could get emergency care. We continued our infant feeding clinics, saw over 230 families there. We continued with Triple P, which was actually quite interesting. They did a lot of online and virtual support, which seemed to take a life on its own, but it's opened up a whole new avenue for them. Preschool speech and language still saw 822 families, and we continue to partner with our children and youth advocacy groups in the community, both in Leeds, Grenville, and in Lanark. And then our healthy youth. So next slide. I think this one is the most challenging. I think this group has really felt the brunt of of COVID and the pandemic the most. Their social circles are so important to them at this age, and we know they were out of school for so long. So it was really important for us to make sure that we did connect with them. And so we launched our new Instagram page for youth and young adult, and it actually was a great saver for us during the summer when we wanted to get the message of even just encouraging 12 to 17-year-olds to get their vaccinations. We had hired a lot of students in our clinics over the summer. And as soon as something was posted on our Instagram, they were so proud to be part of the clinics that they actually just started sharing the stories and passing them along. So Instagram just blew up like fire. It was really, really good. We continued to stay involved in Planet Youth and the Community Youth Advisory Committee in Leeds and Grenville. More just kind of keeping it alive, keeping the flame alive until we can kind of get in there and do a little bit more work. The same with the Wellness Access for Youth in North Grenville. They really focused on ensuring that access to mental health and addiction services for the youth in North Grenville were in place. I do know that they have high hopes for 2022 to work on a lot more of health promotion messages. So that they did great with trying just to keep the services going in these difficult times. And then everything that we tried to do, whether it was our vaccine clinics, we held youth-friendly ones over the summer, and ones for 5 to 11s in the fall, and really tried to make the clinic a little bit more children and youth friendly as much as we can make a vaccine clinic that way. For healthy communities, for everybody else, we know we just need to look at, as Paula said, not just the individual, but everything that surrounds them, including their environment. So we're able to keep a couple things going as well. Probably our biggest success, or one that we're really proud of, we know that nutrition and perhaps weight has been a focus of many through COVID. So we made sure to continue to have a good, strong presence, whether in the media or newspaper, radio, just to talk about healthy eating and acknowledging that some people are finding a challenge during these COVID times. Our Healthy Bodies, Healthy Mind program actually got picked up by CBC, and it was all over their website. It was in all in a day. So our little health unit got a lot of notice from around not just Ontario, but across Canada. So that was kind of fun for us. And then we obviously want to maintain, tobacco-free environment, especially for our children and youth. So although we couldn't do our preventative inspections, we still responded to complaints. We did do some education, provided signage. We tried to keep that going. We maintained some coalitions that we just don't want to see fall during these times. So we definitely tried our best to keep active in that. And then provided comments on the municipal plans, and of course, continued our monthly monitoring for fluoride levels in municipal water sources. Keep going. Okay, so smoking cessation, another thing that we continue, and we still continue to this day. And then our SmartWorks and needle syringe and outreach program continued. You can see our numbers there. We were very, very busy over the year. We were successful in keeping our community support navigator role program going. And these are 2 new staffs that we hired under SUAP Health Canada grant. And they are peer support workers with real life experience in addictions. So they work alongside our health coordinator, health our harm reduction coordinator, and work with the clients themselves, help deliver some of the safe equipment, provide them information, help link them to services, and just be that one extra support person. So that has continued as well in 2021.
And now we turn it over to Teresa Clow, who's our manager in community health protection.
Thank you, Paula. Good afternoon, everyone. So I've got a few more stats to add to the pile here. Most of this is around from our inspection team. So we do have what's called a duty desk where general calls can come in from the public, and this can be anything from a question about water or reporting a complaint or report a foodborne illness, anything. And it also supports our communities so that as part of our 24-hour response, so that adverse waters and that can be reported, or any emergencies. So this year, 2,914 calls came through that line. They can take a various number of minutes to a half an hour, depending on the intensity of the call. We also covered 51 general complaints in land control, so around our sewage program, with probably reports of septics that may not be functioning properly or those types of things. We had 31 complaints followed up. COVID-19 complaints, the number may actually be higher than this just because there were so many of them, and documenting may have been a challenge at times. So COVID complaints would have been things around premises that may not be following the requirements under the Reopening Ontario Act for that particular phase of the pandemic. It could have been about not wearing masks, not just concerns from the public, or other businesses, calling in against other businesses that they felt weren't following things. There was a lot of education around resolving these complaints. Our first goal was education, education, education. However, if we didn't get the results that we needed to, there were some that did result in enforcement activity or warning notices, but most were resolved with education, which is great news. Our personal service settings were open, closed, partially opened over the pandemic in the last year. So we did manage to get 140 inspections done in those settings. They're fairly high risk settings, again, because of the closeness between the operator and the person receiving the service. So doing COVID checks to ensure that they were following the requirements set out in the regulation, as well as the COVID regulation, as well as their personal service setting regulation, so under the HPPA. So fairly intensive inspections, but we were glad that's a fraction of the ones we have, but considering it was a pandemic, that was good that we got that many of them done. I don't have percentages here this year because sometimes they can be a little bit depressing, but even with most of our team being redeployed to pandemic efforts in one way or another, whether it was the infectious diseases team and outbreaks, or answering the calls and responding to complaints, we still managed to get 1,360 food premise inspections done. And of course, that number is going to vary over the year as we do our reports, because again, some food premises were closed during when we were totally shut down. Some chose to maybe be functional with takeout and maybe not the seating it. So this varied over the course of the year. And some of our food premises just felt that it was better for them not to operate, that they could not operate under the conditions set out in the ROA. So our stats are going to be difficult this year to sort of figure out with the exact numbers, but we did get those inspections done. And we do have 66 childcare centers, and we were able to reach out to each one of them with an infection prevention and control inspection, as well as their food handling service inspections, and provide advice around COVID. And this is a group, again, which is a very high risk setting, especially as the pandemic started. Lots of fear from operators and parents, and how we were going to keep their kids safe. So we worked really closely with those operators to ensure that we were supporting them as best as we could. And again, even with the pandemic, with pools being opened and closed, we still managed, these are mainly summer inspections that we got done when those were permitted to be open. So 126 public pools. So that would have been our municipal pools, so Class A, as well as the Class B. So that could be hotels, motels, those types of pools, as well as the spas that are accompanied with them. Next slide, please. We did continue with providing many of our essential services. We do have a requirement to respond to reports of adverse water quality incidents for our regulated systems within 24 hours, and we were able to meet all of those requirements. We continue to support our private water sampling program in all of our facilities or in all of our offices that were open. So we had water bottles available for people to pick up. And we had to be creative on how to drop off when our offices were closed, but that program did continue running that whole time. So that private wells could be sampled and we could ensure their water supplies were safe. And then again, there was ongoing support for some ongoing incidents. Some of these last for months to years when it's groundwater contamination. So we've been working with community of Spencerville. There was Highway 43, which was the PFAS contamination of the wells there, and that's going on over 4 years. So still on the go. Portland landfill with the contamination of some wells in that particular area, and the NRC. And this year we also saw an increase in reports of blue-green algae in some of our bodies of water. So we were responding to those things as well. Okay, the Healthy Environments team again responded to follow-ups of complaints in food places. So somebody may have eaten somewhere and thought they got foodborne illness, so we would have to follow up to see whether that actually did happen, and follow up with the restaurants to see if there was anything that may have contributed to that and put corrective measures in place. We did have students this year that took 211 beach inspections. So that's a lot of sampling going on, but it was good to keep that program going, especially in the pandemic where it was important for people to be outside and out in nature, and also as part of a cooling strategy for those high heat days. With vector-borne surveillance, we did continue our mosquito trapping program this year. It was continued for every 2 weeks because of our risk assessment from the previous year. And we're happy to report that we did not have any positive pools of mosquitoes for West Nile virus identified this year. Part of this program is not strictly about West Nile, that's the main thing, but when we trap mosquitoes, it also is a good surveillance tool as part of climate change to see what kind of emerging species of mosquitoes that we may be getting in our area, as well as what types of emerging diseases they may bring to our area. So that it's a valuable tool for us to get a good pulse of what's going on in Leeds, Grenville, and Lanark. And we also, we didn't complete as much tick dragging as we would have liked to. We were kind of later in the season, and then it was hunting season, so it wasn't safe, but we did manage to drag at Murphy's Point, and we did identify that the black-legged ticks in that area are now positive for not only the bacteria that carries Lyme disease or causes Lyme disease, but also for anaplasmosis. So I guess we have the high right there that we're the first one in the area that had that type of a population of ticks. So we'll have to be doing a little bit more education around prevention of that particular disease, although it's not reportable at this time. Okay, so next slide, please. So this is a little bit more about our infectious diseases prevention program. I guess, Becky, this might be a little bit of yours. And then I think I have a little bit back and forth. So we'll let you go.
A little bit back and forth.
which really describes how the two program departments work together, actually, on infectious disease.
Yeah, especially with infectious diseases. So yeah, our sexual health clinics continued with appointments. We actually moved to an appointment model for 2021 that seemed to work well. When things were a little quieter, we did allow for walk-ins, but being able to book by appointments only allowed us to manage the client flow, because a lot of our clinic staff were redeployed to COVID. We still were able to manage 388 STIs in the community, and we actually worked closely with some primary care partners to develop a form to just facilitate the communication between primary care and ourselves if we're kind of co-managing a case. So that has gone really, really well. It was put in place probably in the spring. And then we did continue again with a kind of modified immunization clinics because again, a lot of these staffs were redeployed to COVID, but we know that for a while, a lot of primary care offices were virtual only. And so many infants weren't getting their primary series. So we kept them going for the year, allowing for infants to come in and get their primary series if they didn't have a healthcare provider doing it. And then, of course, people that fall into any of the high risk categories according to the publicly funded schedule. So those continued as well and still do.
And
Okay,
Teresa.
back to me again. Okay, thanks. Our rabies follow-up program, this year we followed up with 459 animal bites over the course of last year. That was up again from the previous year. I think what we were finding is with COVID, there was more people that were bringing pets home as part of their family. Kids are home, people are home, a lot of pets and people getting on each other's nerves, which sometimes resulted in an increase in bites. Some of them were wild animal bites as well, but definitely an increase in following up those investigations. Out of those investigations, 53 clients did require rabies PEP, and so we provided that mainly through hospitals because most healthcare providers were not operating. So just to prevent them from their exposures, and most of those were around bat bites or wild animal bites, those types of things, or stray dogs where we really could not do an efficient risk assessment, and the physician recommended that they get PEP. Last year there were 8 enteric institutional outbreaks, so in our long-term care homes. We also investigated 112 institutional outbreaks of respiratory infections. So that includes all of them. And this is a big number here, and it lets you know why the team is tired. So 326 COVID-19 facility outbreak investigations. So that doesn't mean that they were all confirmed outbreaks, but regardless of whether it's a confirmed or a suspect outbreak, you have to follow up with everybody to put those mitigation practices in place. And it's a success when they don't go into a confirmed outbreak. So that means that it has not spread through the facility. However, it's still a considerable amount of work to deal with our facilities to get to that point. We maintained our partnerships with our long-term care homes, retirement homes, hospitals, and acute care, and many of our other regulatory bodies. We facilitated this mainly through teleconferences and Zoom meetings. So we were able to bring them up to date on changes in COVID. It was sort of a team effort. So we would have Becky maybe bring things about vaccine. If there were things about case and contact, those managers would bring that information, and our outbreak team would bring the information around what was pertinent for long-term care in those settings. So it was a great collaborative meeting, and we find that our partners really do enjoy those. We distributed 43 advisories and notices to our facilities. And this is another big number, but considering that we were going through COVID, we still had to maintain our follow-up of diseases of public health significance. And so 1,135 follow-ups over the course of the year. Just to let you know about vector-borne, so Lyme disease, as you can see, was 571 confirmed cases last year. So it's still a significant disease burden on our area. The previous year was 569, so it's still pretty close, but a significant number of people that tested positive for Lyme. Enteric disease investigations, 112, so that would be things like Salmonella, Giardia, just to again give you an example of some of those would be foodborne, some may be waterborne. And then in respiratory and other diseases that our nurses would follow up were 448. So it was a fair number of disease investigations over the course of the year. Okay, I think this one is, yep, this one's still mine, sorry. Or is it Becky? Okay, go ahead.
Yeah, this was our case and contact team. So we had 3,593 lab confirmed COVID investigations, resulting in 6,672 contacts. The CCM team also supported outbreaks by taking on schools and child cares. So, so their portion of the outbreak management numbers are there. And this is my favorite topic, for those that don't know. And so, yeah, we had a very successful year in delivering vaccines, you know, and I honestly don't think our little health unit has ever had as much national or provincial attention that it has. But we did lead the province, and we actually still do for fully immunized 5+. We are still #1. Not that I'm at all competitive, and Cheryl Smith will know that on my Tuesday morning calls. So we delivered over 400,000 doses. This is us collectively as a community. The majority of them did come from our mass clinics, but you can also see that our pharmacies are right up there. And the goal for 2022 is actually to shift the percentage of doses more to primary care and to pharmacies, and less reliant on mass immunization. And so we've been working to continue to onboard our primary care partners, as well as pharmacies, long-term care, retirement homes. They're all more and more and more are onboarding to do their own. So it'll be interesting to see what our 2022 breakdown is. But our clinics were a highlight of 2021 for me. And like Teresa, another big thing, a part of our response is just engaging with the community. So as Paula mentioned, attending your meetings on Fridays, you know, our weekly meetings with primary care on Tuesday mornings at 8 a.m. There are times that we have over 100 healthcare partners on the call. You know, it's our opportunity to, you know, give them the latest news, answer their questions, have, you know, some time with Paula. So it's been great. And I know it's been very, very well received. We have a good collaboration with our local pharmacies. I swear I know all of them by first name, and they text me often with questions. So that network is becoming quite strong. And then we continue to collaborate with our regionals, local partners, just to ensure that everybody is aligning and working as efficiently as we can.
And I'll just take, we're just going to
one
go
more.
back one slide. Yeah, just one more. Yeah, so we did attend, Paula, myself, Kim, Jane, quite often would attend virtual municipal EOCs to support them. They became a little less frequent as people got used to the pandemic, but definitely early on they could have been weekly, and also county-wide meetings to inform that level of government, what was going on with the pandemic, where we were at, the measures that were to be in place in our communities. I think I mentioned about the weekly partner meetings with healthcare, and just to kind of keep everybody informed. We also held virtual meetings with our conservation authorities, Ministry of the Environment, and Conservation and Parks, because life was still going on, even though COVID was trying to keep things from going on. Many of those meetings were virtual because people were working from home, but still supporting each other through the community. And we developed some great partnerships with our other ministries and our police and bylaw, especially around the Reopening Ontario Act, and where we could collaborate and make best use of our resources, and what response was appropriate. So that still continues. And we had somebody that was basically dedicated to reaching out to our businesses and supporting them with those changes. There was some times where, you know, things would change from week to week, and it was hard enough for us to wrap our heads around the legislation. So you can imagine for businesses, what do I do this week? What do I do? You know, when can I open? What can I do? How do I do that? So we provided a lot of support to that. And also reached out to some of our partner agencies that support businesses as well. So they were able to help us spread that word. And we foresee keeping those relationships to sort of help promote some of our other health decisions and that go moving forward.
Yeah. So this next one's Becky.
Yeah, so another interesting and different thing that we took on this year was to initiate a call center. We created it in 2021 with the support of United Counties and Lanark County, and they responded to over 115,000 calls in 2021, which is just mind-boggling. In addition to that, we still had to support, we had a couple key phone lines in the health unit, 12222, which is predominantly for our primary care partners for long-term care retirement homes. It's basically a direct line to an infectious disease nurse or case and contact manager to get their answers quickly. We had a school line dedicated to parents so that they could immediately talk to a school health nurse. And then we had a general public line that we would operate in conjunction with the call center. And it alone answered over 34,000 calls. So like those numbers just boggle my mind in terms of just how busy and how involved we were with our community. So, and it's continuing to this day.
Yeah, and Teresa.
Okay, back to me. So we did conduct ongoing regulatory requirement inspections for COVID-19, especially early in the pandemic as those measures were coming out from the government, but we continued all the way through as they were tweaked. We did interpret regulations and provided education and consulted with businesses. Many of them were struggling, and they just needed somebody to talk them through on what they needed to do. In general, most people want to comply. They just need to know how and what's expected of them. We created and updated numerous fact sheets, provided updates. We didn't do the updates on the website. That was our communication team, but we provided that information and press releases, social media messages to get that reach out into the community. Some of the enforcement activities that we did, as I mentioned earlier, with many of our complaints, we were able to resolve them using education and having people come around. We did have to issue 4 Section 22 orders, and those are the order of the Medical Officer of Health. 2 of them were community-based when we had outbreaks that were sort of out of control that was the earlier part of the year. So it was closing down some facilities so that we could get the spread of the pandemic, a little spread of COVID under control. We did also issue 5 tickets for defying public health measures directly to businesses. Most of those were food premises, but not all. Some of them were other retail stores. The other 2 Section 22 orders were specific to businesses that were not complying and we're really vocal about not complying and trying to really, so we tried to work with them with other agencies as well, and the result was that we had to issue those 2 orders, and all were resolved well.
Yeah. So I think the next one is duplication. So I think in the interest of time, we'll go on to Shawnee's presentation.
Perfect. Okay, great. Thank you.
Shawnee.
Thank you, Paula. I'm going to take a few minutes and speak to the work that continued in 2021 to implement our strategic plan for organizational excellence. If you can go on to the next slide. Paul, please. The first driver is our leadership driver. I think you've heard throughout Teresa and Becky's presentation about the leadership that has been displayed by Dr. Stewart and our directors and our managers in the community. And I think that has been recognized, as Becky said, for our vaccine program nationally and provincially and also locally. You can see a picture there of Dr. Stewart accepting the United Way East Ontario Builder of the Year Award on behalf of the health unit. That was in October during an event called This is Community. We did also continue our internal IMS structure throughout 2021 with weekly meetings where all of us that are IMS managers had a chance to connect, be updated, and do some joint problem solving on our pandemic response. We did put a number of staff in acting manager roles as well to help support our leadership team throughout the response, and staff and team leader positions. So we have, the COVID pandemic did create a lot of opportunities for leadership. Our planning driver, Becky, I don't know if you've counted the number of vaccine plans that you submitted to the province. I don't have that metric.
Too many, multiple, too many. Probably like at least 3 times 52 weeks.
Yes. So Becky is our chief planner, I think. We did initiate during the little bit of a break that we had between variants of concern, recovery planning, or at least talking about how we might do that when the time is right. We've done a work plan for the steps we would take. And the first step we wanted to take in a recovery planning was to reflect on our COVID response and get feedback on how we've done to date from our partners and our staff. So we did work with a group called Calian Emergency Management Solutions, who does this type of work for provinces and municipalities and organizations, usually for a shorter term type of emergency, weather-related emergencies. So I think it was a great experience for us and for them to look at this type of an emergency response that is spread out over time. We did recently receive the final report on the reflection, and we're going through it and looking at the best practices that they identified. There were 9 that were put forward in the report, as well as the 16 opportunities for improvement. So we will, at the management table, we'll be reflecting on those, putting together an action plan for how we will address these opportunities in the short, medium, and long term, and getting some input hopefully from staff on those actions that we'll take. Surveillance and reporting has been a big part of our response, our COVID response, throughout the last 2 years, and continues to be a hot topic. Our external surveillance reports, both in social media and the media as well. We are continuously improving and tweaking our surveillance reporting, often based on the type of data and surveillance indicators that we have available to us. And we are now including municipal wastewater surveillance data that we have access to in our external reporting, which is very interesting. And we have recently made some changes to our external report based on the changes that were made for testing in the province of Ontario. And Dr. Stewart works closely with our epidemiologists to identify the indicators that will be most meaningful in that report. We also do weekly vaccine summary reports, publishing our numbers and our rates of vaccine. We do reports to our long-term care and health professionals regularly so that they have data that will help them with planning. And we also do a lot of reports internally that will aid in some decision-making for our COVID response. They're all listed there. So our health intelligence team has been very busy. So the people driver in our strategic plan, incredibly, when we looked back over 2021, we hired 84 new staff, which is a very big increase for us. They were onboarded and deployed to various aspects of our response, a lot for our vaccine response. And funding from the ministry, the one-time funding was used to be able to support bringing on these staff. We try to keep our health and safety plan evergreen, so we're tweaking it and the various controls that are in it. And with the COVID vaccine, we did implement a mandatory vaccination policy in 2021 for our staff. So it's no surprise to anyone. I think it's well understood that COVID-19 has been a threat to everyone's mental health and well-being, the entire population. So this is also the reality for our staff. And as such, we decided to make mental health and wellness in the workplace a priority for our recovery planning. And in 2021, we decided to pursue a program called Mental Health at Work, which is through Excellence Canada. And it's a strategic framework and roadmap for achieving a psychologically healthy and safe workplace. And compliance with this program indicates meeting the requirements of the National Standard of Psychological Health and Safety in Canada. So we have started to put in place some of the key components of this program. We did a call in December out to staff to volunteer to be mental health and wellness champions in the workplace and to help us develop our program. As part of the requirement for them would be to serve on a steering committee that will help us develop the mental health and wellness plan and meet the requirements of the program. Very happy to have received 14 expressions of interest from staff to be mental health at work champions. And this was really a sign to us how important this issue is for our staff. We hope to kick off our program with our first meeting in mid-February. Okay, so our client driver, we just spent the last few minutes listening to all the client center services that we are delivering in COVID-19, both our pandemic response and our essential services. We have received so much positive feedback, unsolicited positive feedback through emails sent to our staff and from our website. And the ones on the right are from the vaccine clinic evaluation that we conducted. And so if we move on to the next slide, I can tell you a little bit more about that formal evaluation. So we've received both, anecdotal and unsolicited thank yous and feedback as well. We did do a formal evaluation of our client experience and satisfaction in our vaccine clinics. And we received, it was an electronic survey done through Checkmarket, where clients at our various vaccine clinics were given access to a QR code that they could then access the survey through. We received just over 2,400 responses to our feedback survey in about a 4-month time period. So that was between, I think it ended at the end of July. And we received ongoing summaries of that from our evaluator to help us continuously improve the program. As you can see, the experience rating of the clinics was very, very high. 99% of the respondents to the survey rated their experience as excellent or good, and were satisfied with the care and said that it met their needs. And usually when we do evaluations of our public health services, we do have very high satisfaction ratings. Don't know that I've ever seen so many 99% ratings in the past. even the booking, easy to book an appointment, received an 87% agreement or strongly agree. And one of the challenges, I think, was our booking system sometimes. Thankfully, we had a local booking system that I think was very helpful. One of the barriers, if you see, was some of the booking challenges too. So I think there was benefit in doing the summaries of the evaluation data as we were going to help make some improvements. And then the middle results there are from our clinic precautions that we took. So you can see again, all in the 90s. People felt our communication was easy to understand, both before the clinic and then after the clinic, as well as the safety precautions that were taken during the clinic. This table would be familiar to you from my presentation last year, looking at some of our communication team stats and just continuing to increase. Really, it's quite incredible. The number of unique visitors to our website more than doubled from 2020, and you can look at the difference there from 2018. Is phenomenal. Same with our webmail submissions, and all of these emails that go to our webmail are responded to. We've actually we've worked with HLD, and we have we've seconded some staff to the communications team to help answering these submissions. And then I think one of the things that happens is when webmail submission comes in and our members of our community get a response, they now have our staff's email addresses and may continue to correspond with them and reach out to them with their questions. So the amount of back and forth is likely much higher. Our Facebook and Twitter followers have also increased. Becky spoke to Instagram being a new social media that we launched this year. And then Sue Healy, our communications coordinator, I know all of you are familiar with Susan, wanted us to make note of the number of media inquiries that have been responded to this year. I don't have the numbers from previous years, but 565, and that does not include the regular media that Dr. Stewart does every Wednesday. Without fail, it's her media day. Many radio interviews and some TV interviews have been done. Okay, this is just, I just wanted to show you this pictograph. I'm not sure that's quite the right word, but it's from a platform that we started using called Sprout Social. And it's a way for us to monitor all of our social media. So these totals are from Twitter, Facebook, and Instagram. So the number of impressions that we've had and the number of engagements, those are indicators of how much back and forth we've had in our social media. And before COVID, you know, we'd certainly used Facebook and Twitter. We didn't have very much engagement with our social media. We did have some comments, and there were some posts that received more than others, but the amount of reach that we've achieved through our social media with COVID-19, I don't think we ever could have predicted. And the next slide, it just shows you some of our top posts. So for there was one in March, that was our top post on Facebook, and it was about going to the red zone, again, back in March. And then on Twitter, it was a reminder for vaccines, and you can see the total number of engagements there just for those posts. So it's quite interesting. Fine, okay. So process and project management. continuing to use file hold, and thank goodness we have it. We've developed 62 COVID-specific work instructions, so I was able to go into file hold and do a search in work instructions for COVID-19. And then the other thing it does for us is version control. So if you look at the number of times work instructions have been changed and versions that they've had, for case management and contact management, you see those numbers there, 58 and 40, which I think speaks to, I know it speaks to the amount of time the directions and the directives and guidelines from the Ministry of Change and our staff have had to digest those and make changes to the work instructions, communicate it out to the teams. The staff have had to learn and how to incorporate this new information into their practice. So the demand, I think, has been so high on our staff to keep up with all these changes. And then in third place comes the staff screening work instruction, which shows the number of times the ministry is changing their questions for screening for workplace. I think the next slide speaks to IT, which has been a vital support for our and very effective support for our COVID response. We have 151 of our employees who are set up to work from home. Not all of them work from home all of the time. Some do, and some mix working from home within office work as well. But having this number of employees set up and capable of working from home allows us to meet the requirements when the province recommends that staff work from home. There are some of our services that can't be done from home, such as our phone lines. So that wouldn't include those types of employees. Paul and his team have provided invaluable technical support for the mobile and fixed site vaccine clinics, equipment, taking equipment, setting the equipment up. Every clinic we do required pre-visits by IT to test for internet connectivity, because we do documentation on site that requires internet connections. So they have been on the road providing that support all year. Paul also was the technical lead to help establish the call center with the counties. We had to upgrade our BlackBerry servers because of the increase in cell phone users, and we're looking at our VDI systems as well, and our firewall updates. COVID-19 provided an opportunity, prime opportunity for cyber attacks. So we were proactive in providing these updates to protect our servers. So fingers crossed, we have not had any attacks. The last driver is the partner driver. Becky and Teresa were very summarized the amount of community engagement that both departments have done with our partners. And I think this has been recognized with multiple awards from the Town of Prescott, YMCA of Eastern Ontario, United Way, the Shriners Club of Eastern Ontario, Big Brothers, Big Sisters of Leeds, Grenville, municipal mayors and Reeves. Numerous ones have expressed their appreciation, as well as you see the Lanark, Leeds, and Grenville Addictions and Mental Health as well. And I think it is so nice for our staff and management to receive the awards are great, as well as the emails of appreciation that are sent in. I know many of you have done that, and your colleagues, as well as from local organizations. It is so, it's a boost to the morale for staff and our management team too, for all the hard work when it's recognized publicly and when it's appreciated in an email message or a phone call. So thank you to all of you. I think I'm done now.
Yeah, so I'll finish up with just a very few slides. You can hear the enthusiasm, you can hear the pride, you can hear the commitment in Shawnee and Becky and Teresa voices, and that is the same thing that is spread throughout this whole organization. And I'm just so proud of their leadership, and I'm so proud of the commitment that all of our staff have. It's just absolutely wonderful. So let's go to the next one. So really short, a couple of slides. We're going to continue with the COVID response. We'll continue with implementing the essential services that were identified today. We are really hoping that things will slow down enough that we're going to be able to add in some of the other Ontario Public Health programs and services that we haven't been able to do so far. And we will begin work on the strategic plan renewal. Very thankful that the board put us off for a year. Next one, please. And the big one is to be flexible and adaptable. We're going to be looking at the program departments and how best to organize them, and the governance committee is involved in that. We'll continue to collaborate with our healthcare system partners. We are working more and more closely with them, which really, I think, bodes well for collaboration into the future. And then you can see all the local partners, all of that work is going to continue. And then the last one, please. And so we're going to reflect on, just like you have heard today, we're going to reflect on everything that we've done, which is an incredible amount of work. Really continuing to build that strong workforce. Shawnee talked about the mental health at work, but all the things that have been working for us, we will continue to do that, and also continue constantly to look at promoting health and safety. And I want now to say that Jane Lister, this is her last board meeting. Jane is retiring after many years being the director of community health protection. And Jane, maybe if you could turn your picture on, where are you? She was there for a bit. Oh, did Jane leave? Oh, well, this will at least we'll be able to put it into the Cogeco broadcast. I am so pleased to have worked with Jane. Her sense of humor, her vision, her out-of-box thinking have always been entertaining, have always been incredibly useful, often pointing the strategic leadership team in a way that we really needed to go. So we say goodbye formally, publicly to Jane. We're going to have a party for her tomorrow. She's been a great friend, a great coworker, and we're going to miss her. So over to you, Doug.
All right. Well, thanks to Shawnee, Teresa, Becky, Kathy. Oh, no, Kathy didn't speak. At any rate, there was a lot of information, and given the amount, there was a little opportunity to ask questions. I would just ask anybody or everyone to reflect on what we've heard today, and if there's areas that you want repeated or delved into a little more, I think we can have a portion of ongoing board meetings to pick up on any particular area that you'd like reviewed more again. It certainly was done in detail. You have something, Doug?
Thank you very much, Mr. Chair. No, just to thank everybody involved for the great presentation. It's a look, dare I say, look back over one's shoulder. I think going through a pandemic when it started in March of 2020, we didn't even know what was ahead, let alone what we might be looking back on. Here we are 22 months later, and dare I say it? Well, I will, because the provincial Minister of Health, Elliott, said at the Roma conference, things are looking a little bit better over the next, number of months, and we may be going from a pandemic to an endemic. Who would have thought we'd be using that kind of a word in our language? But my point is, today's presentation is just, the skim of the surface of the incredible amount of work that was done, but work that was needed to be done, not just in the relation of COVID. Work was needed to be done just because, notwithstanding COVID, people needed, health assistance, care, et cetera, in Lanark, Leeds, and Grenville. So appreciate the very high level overview. From my perspective, don't need to delve into it. Anything and everything we did had value, had merit, and justified. So thank you for that, Mr. Chair. And thank you to Paula and all of her staff.
Thank you very much, Doug. I see Bill Dobson has his hand up. Jeff, did you have your hand up also?
I think Jeff was ahead.
Do you want to go ahead, Jeff? You're muted, Jeff. Jeff, you're still muted. Paul,
There, I think I got it now. My mute button moved. Can you hear me?
yes, we can hear you loud and clear.
Okay. Yeah, I've got another meeting to go to, so I'm gonna speak quickly. And there's some other questions I'll ask Paula directly later. But the one, first of all, before I forget, I wanted to congratulate Jane Lister. Has been a great employee for a number of years, and I like Paula particularly, like her out of the box thinking, because maybe I'm out of the box too. So, you know, best wishes to her, and I believe she's heading west to meet with some grandchildren and enjoy retirement, and I wish her nothing but the best out there. But the thing I was worried about, and I suspect everybody on the board is worried about, is we're watching like that truckers convoy and things go on. And I'm just worried that, you know, there seems to be, you know, two sides of it are drawing the battle lines in the sand right now. And I just, you know, I'm just worried that, you know, if something doesn't happen to sort of take the pressure off this system, we're at some time we're going to need to talk about, you know, hopefully we won't ever have to talk about lockdowns and things again. But if we don't take the foot off some of this, I'm afraid that, you know, there's going to be the two sides are going to be so far apart that that we're not going to have the credibility when we say lockdown to lockdown again, or the support to say lockdown again. So it's a concern in my mind that, you know, I think we've been through some lockdowns, a lot of them. There's a lot of people that are, you know, been through the lockdowns, particularly small businesses that, you know, there is no unemployment insurance for them. There is nobody to pay their rent. And, you know, they sort of remind me of somebody on the edge of a cliff, and, you know, they've had their fingers stepped on a few more times, and one more time and they're going off the cliff. And so, you know, I think it's important that we, you know, keep that in mind, that, you know, we have to be careful. And I guess maybe a lot of stuff you can learn from Mother Goose is we have to be careful crying wolf, because eventually no one will pay attention to us. And so, you know, and I'm not by any means suggesting that we've, you know, been less than prudent with our calling of this, but some of the public are really in tough shape, and, you know, even, you know, sort of rally the troops much more. We have to be very diligent that we're not overdoing some things. So, you know, and it's a real worry in my mind that if we you know, pull the card too often, it's not going to be effective. And so I just wanted to say that you know, and, you know, it's not a medical opinion, it's a human nature opinion. So but otherwise, you know, to the hours and hours, and I don't think there's anybody on this staff or any other staff that's seen a uptick in the amount of work and follow-ups and things that they've had to do. So, you know, kudos to you know, picking up your game at the right time, and thanks to, you know, everybody and the staff that can hear me, and the ones that can't. Thank you.
Right. Thank you, Jeff. And I certainly, I'm going to take this opportunity to echo your congratulations to Jane Lister on her retirement. That's something I make sure I didn't miss. Certainly, I came to know her contribution also. And I would concur with everybody that they were very significant, and wish her well in her retirement. Yeah, and Jeff, you're absolutely right. When something goes on and on, tensions can build and grow. And I think there's going to be a great exercise once we've got breathing space for everybody to be looking at how it transpired and what the lessons learned. I'm not sure that there's any magic solution to it, because things kept changing so quickly, and I suspect the next pandemic will be the same thing. But there are some lessons to learn, and I think as a board, we'll make sure that we focus on what we should acknowledge and look to the others to do the same thing. So thank you. Bill, did you have comments?
Yeah, thanks, Mr. Chair. Just two or three things. I have to say, first of all, I'm not very old, but this is my 56th year working and volunteering. And I don't think that I've ever worked with a group, that being our staff and our board, that is so dedicated and passionate and caring. So again, huge thanks and congratulations, like everybody is saying. When I hear, sometimes we hear people being negative in the public, and I do find that there's people being negative, not necessarily now, but how we came out of SARS, and the fact, and what they say there was that we came out of it and we didn't really learn enough and have a plan. But from hearing the presentations today, you know, we definitely have a plan. The staff here have talked about best practices and action plans and so on. So I do feel that I feel very positive. And yet when you talk to some people, they say, oh, we don't have a plan. We never had a plan. We didn't have a plan from SARS. So we don't have a plan now. Well, I think from what I'm hearing, you know, we really do have a plan. So that's really great. But even though we're reporting so many positive things, we'll never be perfect, and we can always improve. And you know, and I think we will with the people that we have working for us. But a couple of things, I just have a couple of questions, and that being which still bothers me. And most of you know that I'm a kind of a food addict, you might say, chairing the LGL Food Corps, which is Leeds, Grenville, Lanark. And I heard our staff talking about you know, good, healthy, accessible food. The problem is right now is I'm not saying the health unit, but just we in general have not done a great job. And it's now becoming one of the biggest things that we have to talk about in the political spheres, that being the whole lack of housing and the lack of good, healthy, accessible food. The problem is, most of all right now, it might be healthy and it might be accessible, but it's not really, because it's not affordable for so many people. So that we still have a lot of work in that field, I think. The other, I just wanted to have one question also that I've been wanting to ask. And I hear it, you know, more in the cities where they have these big water treatment centers where they do a pretty good job detecting different things that are happening as far as healthy issues and so on. But I'm just wondering, like locally in Leeds, Grenville, Lanark, how close do we work with the water treatment centers that we have? I mean, we don't have a lot, but we have some. So that's a question. It's just a question. But anyways, other than my question, again, I'm really, really proud to be able to work with this group. And as I said, it's amazing. So thank you.
Thank you, Bill. Do you want to take that, Dr. Stewart, or one of the other speakers?
Probably Teresa. Doug, probably Teresa.
Great, thank you, Teresa. We're having trouble with our mute buttons.
Okay, sorry, it wasn't showing up. Are you referring to the wastewater treatment that
Yes.
some of our cities have been doing?
Yes,
And detecting COVID? Yeah. So we do. I guess John Cunningham, our epidemiologist, has been working with. I believe there's 3. So Brockville, Kempville, and Carlton Place is the new one, or I think that's added on.
Yeah, no, we're working with Smith Falls.
Okay, so thanks, Paula. So yeah, we do. Those indicators are great indicators, and considering we've lost a few of the other ones where we're not counting all the cases, it's interesting. And John does do reports on those, so we do have some in the community, and I believe if there's funding that may expand. I don't know whether you want to add anything more to that, Paula, or.
Yeah, thanks, Teresa. I wasn't quite understanding. So it's a program that's actually being run out of Carleton University, and they've got provincial funding. So we're fortunate that we had 2 municipalities that signed on right away, and they've just had additional funding. So we're just working with the 3rd. So that information is now up on the surveillance report, and it helps us understand what's happening in the population as a whole. Basically, when you're exposed to COVID, you breathe it in, you also swallow it, and then it goes out the feces. And so it's a really helpful program. And so go onto the website and you can see how we're tracking things. And it's a collaboration between our municipalities, Carleton University, and the province.
Thank you.
Thanks, Bill.
Very good. Is there anybody else that wishes to comment or question?
I just would, it's Cheryl here. I just wanted to talk also and congratulate all the staff on their ability to respond very, very nimbly and effectively, not only to the local community, but to the provincial guidance and the federal guidance that they also drove a lot of the decisions about lockdowns and other decision points that we had to comply with, and not on a lot of time to make those switches around in terms of policies and whatever. So I think sometimes we've been in this for so long and we get buried in the sort of local issue and forget this is worldwide. This is a huge historical moment in time, and that lots of the decisions were totally out of our hands. So I think that speaks to some of the comments that Jeff was making. Thank you.
Yes, thank you, Cheryl. And I just say that during the talks, I kept having this vision that we often talk about, the duck looking calm on top of the water and the feet going like crazy below. And what came out of these talks was the feet are not only going fast, but they're going smart.
Yeah, that's nice, Doug. That's good.
Is there anybody else? With that, then I'm going to move on to the agenda, which will take us to 7.1, and we have a Board of Health vaccine policy. I have a motion for that, and I have it moved by Doug Struthers, seconded by Tony Circo. And the motion reads that the Board of Health COVID-19 vaccine policy be approved as circulated. So is there any discussion or comment with that before I call a question?
Pleased to be the mover.
I thought of you.
Well worded and appropriate. Thank you so much, everybody.
Cheryl,
I'm happy to second that motion.
great. Thank you so much, Sam. All right, I'm going to call a question by asking if there's anybody objects to my declaring this motion carried. Seeing none, the motion is carried. Thank you all. Now, it indicates that we have an in-camera meeting. So I'm going to have to move us on to that motion. We have at least one item. I'll have to check the other if there's a second. So for the in-camera, I have it moved by Jeff Earl, seconded by Cheryl, that the board move into a closed session of the Board of Health due to the following. And what has been indicated is personal matters about an identifiable individual, including municipal or local board employees, and G, a matter in respect of the board or committee may hold a closed meeting. So, unless,
Point of order, Mr. Chair.
by all means, go ahead.
Yeah, I noted that Jeff Earl has left the meeting, so if you would like a mover, I will be the mover.
Thank you, Doug. I did miss that. He mentioned he was going to have to leave. Didn't realize it was right away. Thank you.
Yep.
Any comments, discussion with regard to our voting and going to the closed session? I'll call a question. Does anybody object to my declaring this motion carried? There is none, so it is carried. That moves us then to 8.2, which is governance. And